Well, let's open up our official Q&A session. You can ask any question to any of the panelists or a general question that you would like to hear perspectives across the panel. Is there? Yes, perfect. Please go ahead. Microphone is coming your way.
Thank you. My name's Spencer. I'm a Master's of Public Health student here at the U of A. My question is specifically directed towards Mr. Rockcliffe, because it is about the Lauderdale Seniors Development, although if anybody has input, I do invite you to contribute. I wanted to talk about the public plaza that you talked about with the development. You said that it's intended for the use not just of the residents, but for the whole neighborhood. However, I imagine there'd be some concerns, I know I do, that if it's between the buildings and on the plot of land of the development, there may be an implicit connotation that it belongs to the development, that it's the private space of the residents. And I wanted to ask, how do you work with the built form and the area, more the built form, to create a space that's inviting not only of the residents, but of the entire neighborhood, to specifically invite them into the space and show that this is also for you? Thank you.
Thanks for the question. Well, I think in this case, there were some unique circumstances that that hopefully will invite people that aren't part of that development into that common space. It's a relatively short depth of block, and there's no development immediately behind it. There's that multi-use pathway. So, I think those factors will hopefully invite people into that space who aren't residents. The sides of the building that face that space, there's windows, but there's no entrances. It's I think it presents itself as a bit more of a space that people from the community could go to, or to pass through to go to that multi-use pathway.
Thank you. One more question in the center. Can we pass the microphone?
Oh, thank you. Thank you very much. My question is for Jonathan Rockcliffe as well regarding the development there. Did you run into any bylaw barriers or zoning barriers when you did that redevelopment? And then also did you have to do like a public engagement with the folks around it because you were changing, well, it was still residential, but was there a public engagement process? Thank you.
To answer your first question, we did have to rezone the property to allow for the greater density and for that type of housing. So that was a process that we did have to go through with the city, and that does tie to to your second question about the public engagement. So there were two forms of public engagement. One was around the rezoning of the property, and the other, which was, I guess, a little more formal because that was with the city. The other community engagement we did with the owner was with the community to talk to them about the new development and to hear what they had to say, what they wanted to see as part of that development. And I think a really important piece of that, and Jill mentioned it, is coming to those public engagements without any preconceived ideas of what the project is or should be. And our very first community engagement was, we had no designs done. We didn't provide any options. We just, came and had a public open house. It was pre-pandemic, so it was in person. And we did two more after that. After we heard initial feedback, we developed some options and we got feedback from those. And then when we thought we heard what was, a preferred direction, then we presented the final concept. So, yeah, we tried to get as much input from people as possible, because that makes for the best design.
Thank you. We'll go back there first, if you can. Yeah, right, yeah, perfect.
Hi, thanks so much for the excellent presentations this morning. I have a couple questions for any of the panelists who want to respond. I'm curious around net zero affordable housing and the future for that, and if you see that changing and becoming more prominent, and also around multi-generational buildings and housing sites, and if you see that also coming up more in the future for innovation. Thanks.
Sure, I can maybe talk to the net zero piece. I think we're moving in the right direction. Our firm hasn't done a net zero project, but with every new iteration of the building code, we see more and more requirements to provide better insulation and better energy performance. And the project that I talked about today, it did get the federal funding, and that mandated that the energy performance had to be 20% better than the present code. So there are things happening, and we do have discussions with owners around around that. But I think the biggest challenge is just the capital cost needed upfront. We all know the benefits of doing it, but it's having the money upfront, not just to build the building that you want, but to also add to that the added costs of doing it as a net zero project.
I'll jump in on the aging in place question. I think it's a really interesting one, and North America is pretty unique in the fact that we don't actually live in multi-generational families. Quite a few cultures in the world do, and that's normal. And as we deal with an aging population and increasing pressures on family and care for children, it is driving a lot more conversation around aging in place and multi-generational families. I think in this room, everybody gets it. It's just how do we get that information out to developers and to the market so that they have that return on investment. But through a lot of our work at Dialogue, we are seeing more and more interest in developers who have that flexibility or want to bake it in. So, it's 1 or 2 bedrooms with like lock-off units. And so I think it's starting to happen more and more as the North American marketplace realizes that the way that we need to start living needs to be reflected in the way we start building to live.
I wouldn't mind, I'll talk about your question on housing and net zero. I was at a conference or a panel series on the climate, we call it the climate imperative. And we had a developer panelist, one of our speakers, who was the president and CEO of Allied REIT, Michael Emery, and he was fascinating in the perspective he brought to that exact subject. He said, they're already seeing it. If your building is not highly sustainable now, you probably won't be in business in 10 years, 15 years, because the demand, the renters or the purchasers of the residential units are already saying, no, I'm going to pay more to go down the street if it's highly sustainable. And I found that fascinating because 10, 15 years from now, they might not even be able to afford the insurance if it isn't highly sustainable. And so that was a really interesting perspective. So what they're trying to do is study, they're agreeing to take certain sites that they're building, one particularly in Vancouver, where they're saying, okay, we're agreeing that our return on our investment will be very low, to test to see how we can afford to make it more sustainable. So kudos to Allied, I think, and more developers have to do that. Great question.
Do we have time for one more question? Okay, maybe one more question up front.
Thank you again. I just wanted to go back to Tom, if I may. Specifically, thank you again for information about the support that's going to go to chronic disease management. And if you have a chance to talk about that, but I really want to perhaps preface this with in the Frankfurt City Forest, as Dr. Wilkie was expressing to us, and the Laurier Heights community, that there has been trees put at the center of these areas and in places that we know that public will access them. And we know that flora reduces erosion, provides habitat for wildlife, gives shade. It reduces building energy consumption and helps with our heat islands right now that we're experiencing. And I know that a study published by the Canadian, or Statistics Canada showed that the cities across Canada have been becoming less and less green since 2001. So could you, or anyone else who would like to on the panel, express how we could support that?
Sure. We have, with these large municipal projects, there's all kinds of, it often seems like they're restrictive and that it's hard to get some of these things to happen. But we have talked about a grand vision of, wouldn't it be amazing if we had the community gardens on the campus, the neighborhoods, people came and maintained, and then we used that fresh produce in our community kitchen and invited those people who have grown that food, as well as patients and families, to come and prepare food together. So we've talked about that. We think that that doesn't seem so far-fetched. We'd have to get through some, whatever restrictions there might be, but we think there are opportunities for that. So, yeah, that'd be amazing.
I'll add back on my soapbox about trees is it's all too easy to cut down a tree. I think a lot of times people see them as obstacles to construction. And it's, Edmonton has one of the most unique urban forests in the world with the amount of original American elms that we have, and they need to be protected and planted in construction. So again, as community members and citizens of Edmonton, we can also advocate for sometimes it's the harder thing to save the trees, but as you've indicated, we're becoming less and less green in our cities, and it's an important piece of the sustainability conversation. So I'd put it back to everyone in this room to go and advocate for the protection of our trees.
I didn't talk about this, but we had originally thought about a traditional community garden, and then we switched to the food forest idea. And there's all kinds of, I think, really good reasons to do that. And I wonder if, as I listen to all these designs and plans, thinking about trees that actually are edible might be valuable. The food forest has 7 layers that are all you can eat, from asparagus and rhubarb on the ground and strawberries right up to, plum and apple trees. They all grow in our climate. The hascaps and raspberries, people just walk down our little path to the community hall and they can pick and eat these. So why can't we do that on some of our streets and landscapes and so on? And they're totally sustainable. So just an encouragement to think about edible forests.
We're going to close the formal Q&A session now. Please feel free to connect, of course, to our panelists with further questions. One thing that came to my mind as I was listening across all of the speakers and hearing the amazing stories of what's been done and where we're going is the idea of working together. And the idea of partnerships and how we can think about some of those non-traditional partnerships that we need to build in order to do things differently. And so I think there's a lot of inspiring examples of that here and opportunities, as you say, to do that as we move forward to really achieve those goals of healthy communities, healthy cities, and integrating actions across the healthy community guidelines. So I'd like to give a standing ovation again to our wonderful panel for appreciation. And thank you so much. I'll turn it back over to you, Dr. Lee.